Unfortunately, there was a recent uptick in serious car accidents due to speeding on the roads lately since the state has closed. So we're checking in with Dr. Jonathan Gates. He is the chief of trauma at Hartford Hospital and Hartford Healthcare, and we're going to see what they've been experiencing on this topic. So thank you for joining us, Dr. Gates.
Thank you very much for having me.
So as the state slowly begins to reopen, have you noticed any changes when it comes to car accidents? Are there more, or are there less than what we saw a few weeks ago?
Well, there are more, and with the good weather and more people out and about, you can imagine there is more room, and people are speeding now. So we are beginning to see an uptick in the number of patients who have severe high mechanism injuries. And this includes not only automobiles, but motorcycles as well.
Certainly. And what are you expecting from these summer months as people start to venture out?
Well, I think you're exactly right. In the summer months, the weather is good. People do want to get out. And I think, we've been cooped up now for a couple of months, and I think that they're anxious to get back to life as it was if we could. But there is a new normal situation, and we have to learn how to adapt to that. But I would anticipate that there is going to be a continued uptick in that trauma volume and the high mechanism volume. We are seeing that now, and again, I will take the opportunity to say I think that we have to be mindful of that. And then again, the message is always the same, even despite this COVID-19 situation, that we really need to minimize the alcohol intake. I think we have to be very vigilant about that, about speed, alcohol, texting, and again, I would underscore the fact that people do need to wear their seatbelts.
Seatbelts are definitely key here in, of course, trying to decrease the amount of injuries. And speaking of which, you've been talking about the new norm. Many are fearful to go to the hospital because of exposure to COVID-19. So what kinds of hospital safety measures are in place?
Well, I can understand that fear. I do think it is unfounded, though. And when you think about it, we do have patients in the hospital who are positive for COVID-19. It fortunately is on the downtrend over the last several weeks now, which is great to see. But I think that the hospital and Hartford Healthcare in general has done a wonderful job in terms of cohorting those patients, of taking care of them and identifying those patients who are positive and putting them in certain areas of the hospital, whether it's on a floor bed or a step down or an ICU, and really minimizing the cross interaction with other patients that have non-COVID related injury and illnesses. And I think we are really doing a good job in making sure the workforce is healthy. Every time we come into work, our temperature is taken. We have to answer a few little questions about our general health to make sure that we are not, in fact, asymptomatic or symptomatic carriers of the COVID-19 disease. We do know it is a person-to-person transmissible virus, and I think that everybody in the hospital is wearing masks. I think we are practicing social distancing as much as we can in the hospital, and we are very vigilant about really taking care of each other in terms of that. And I think that patients are being tested. We're determining that they are positive or negative, and we're able to bring them into the operating rooms now and begin to take care of these problems that people have put off for fear of contracting the virus. I think in some ways the hospital is very vigilant and quite safe from that standpoint.
So wear your masks and wear your seatbelts, right, Dr. Gates?
Absolutely.
All right, thank you for joining us. Thank you very much for your time, and thank you for everything that you're doing.
Well, you're very kind. Thank you very much.